Good day. Thank you for joining us on the People Chronicles. I'm Dr. Tammy Balatgek, and we are bringing you another episode of our series called Your Mouth is the Door to Your Health. And today I'm joined by a longtime patient and friend, Donna. So thank you for being here to tell your story.
Delighted.
Thank you. And we just want to share a little bit about what you've experienced in our office. And if you want to start with your symptoms and what you were suffering with, that would be real helpful.
Terrific. I came to you, as you remember, in 2007,
Wow.
which is a huge long time ago. It doesn't feel like that much time has passed. I came to you with a boatload of symptoms that I just could not pin down between the neurologist, the chiropractor, the general practitioner, all of those people, a different dentist who wanted to grind all my teeth down. That was fun. Between all of those symptoms, I came to you and said, okay, what can you help me with? Can you help me, or am I just broken forever? Because I wasn't sleeping. I had so much pain, I wasn't functioning during my day.
Sure.
And it was just terrible. So I came to you and said, all right, now what do we do?
Yeah, so you came in and then we did a complete exam and we figured out that your jaw was out of alignment. And when the jaw joint is out of alignment, it can pinch on a lot of nerves, including the trigeminal nerve, which is implicated in migraines. And so we presented a very non-invasive treatment plan to you of wearing a night guard. Do you want to share a little bit about what you had tried up until that point that didn't work?
I had been on some heavy-duty meds. The doctors were very confused by me, and they kept saying, you shouldn't be having this pain, you shouldn't be having this pain, there's nothing wrong with you. I'm sure other people experience that. And it's very discouraging to walk into a doctor's office and they look at you and they write all this down, and you feel like you've just not been heard.
Sure.
You know, and not being heard when you're nauseated, your eyes hurt, you can't read, you've got pain that is so piercing you want to cry. When you have all of that and they tell you nothing's wrong and maybe you should see a psychologist, that's when it really gets a little dicey.
Yes, unfortunately, TMJ disorder is often misdiagnosed.
Absolutely.
And our patients end up seeing neurologists, ENT doctors because their ears hurt,
We'll
their
go anywhere.
family doctor.
We'll go anywhere.
And the problem is there's a lack of education out there. Many physicians and even most dentists do not understand the complexity of the jaw joint. So like you, patients end up with medications that have side effects, Botox injections.
That was fun. I did not appreciate that one. But the doctor was assuring me, it'll take away your pain, it'll take away your pain. Wear this little piece, it'll take away your pain. Let me grind your teeth down. That'll take away your pain. None of it did until I landed with you. Forever grateful for that, because your treatment and your staff, they have changed my life. I function because of you. I function.
And would you like to share with our audience what our treatment is, what you're wearing to help your jaw?
Sure. Right now I wear a nighttime appliance. It has two small straps on either side to align my jaw, bring it a little forward to help with grinding of my teeth and the jaw placement so that I breathe better and that my body isn't acting out in sleep what I experience during my day, which lots of us experience stressful days. So I've been wearing this now for 7 years. I think I've had 2 in that time frame, and I don't go anywhere without it. I've even turned my car around to pick it up.
Wow.
Because I can't be without it. It's too much pain.
So you were spending a night away from home and you forgot it.
Yes,
Okay.
I did. I'm sorry.
And that's very common. We have several patients that order a backup appliance because they're afraid of being without it.
Why didn't you offer that to me, Dr. Tammy?
So Donna's treatment is non-invasive, very little side effects, which could include your teeth getting sore or the bite feeling a little bit off in the morning. But unlike medication, there's nothing that's going to happen to your body systemically to cause side effects.
Well, and it allows the rest of my body to heal instead of drugging myself which is what I had been doing for years before I saw you. I was able to be off of those drugs, use that appliance, and allow my body to come back to a semblance of normal, because I was
Awesome.
treating it with a non-systemic mouth appliance. It's fabulous.
And the mechanism behind that is this mouth guard allows you to sleep better.
Yes.
And when you reach deeper levels of healing sleep, then your body can make growth hormone, which heals and repairs the cells. Medication is sometimes a Band-Aid, and the jaw problem is a structural problem. The jaw is out of alignment.
And it's nothing I did to make that happen.
That's
No,
how
it
your
just-
anatomy lines up.
It's just what it did.
It's your body. So it can be a family trait from your jawline. It can be diet in the early years, how your jaw forms as you're growing as a young child. So, right, it's nothing that you did.
Well, at that point, both of my daughters came to you. My daughter Kate was experiencing extreme issues that we couldn't pin those down either. And I didn't even think of the TMJ because it was presenting differently. She couldn't read, her eyes wouldn't focus. She had headaches. She was actually dealing with some asthma issues, some things that did not necessarily present as TMJ.
Right.
Brought her to you. And she wears an appliance, still wears an appliance, and she's now 26, I think it is. And it has changed her life as well. She's functioning. She's a delightful young woman, able to sleep, able to do what she needs to do in her life because of that.
So it may sound a little bit unusual to the audience that a mouth appliance can help you see better and change your eyes, but the mechanism behind that is the trigeminal nerve that I mentioned earlier has 3 branches, and the 3rd branch goes to the eyes. So if there's inflammation in that nerve, it can cause some vision issues.
It was horrible.
And once the inflammation heals, then it clears it up. So
that was a fabulous fix for her. She doesn't sleep without hers ever either. So we're very grateful for that.
And then your other daughter, Abby, went through orthodontics in our office.
She did, and we actually were looking to prevent, as you recall, looking to prevent TMJ in her future because her jaw was narrow and misaligned, and she looked adorable, but it didn't matter. She needed to have that taken care of, and you were able to do that. You used a spacer. She has an appliance. She too is on that same page. She wouldn't be without it. Neither would Justin, neither would Paul, husband and son. So it sounds like we're a family affair. We're a family affair.
Yes.
6 out of 8 of us go to Dr. Tammy, which truly your ability to help us live, it's amazing. My husband doesn't snore anymore. Hello, ladies, hear that? Men, hear that? Yeah, no more snoring. That's huge.
Yeah.
That is huge. And that was a different part of what went on. He wasn't dealing with TMJ.
Right. It's very common for women to present with the TMJ disorder, with headaches and jaw pain and sleep issues, insomnia. And on the male side, they don't have estrogen receptors in the jaw joint, so they're not likely, or they don't have as much estrogen as we do, so they're not likely to feel the pain of it. But if their jaw is out of alignment, they may be snoring or have been diagnosed with sleep apnea. So it does present differently. And that's why we do both things in our office, because they're so closely related by the jaw position. So, well, thank you, Donna. We really appreciate you being here and sharing your story. Do you have any final words to anyone out there who might be suffering and wondering what to do next?
Go. It costs you a couple hours of your time. Go see Dr. Tammy. If she has nothing to offer you, she'll tell you. She's incredibly honest, incredibly ethical, and incredibly good at what she does. Our family would not be who we are without her. And we are very grateful.
Well, thank you very much.
You're
Appreciate
welcome.
you sharing your story. Again, my name is Dr. Tammy Balatgek, and I'm with the Center for TMJ and Sleep Disorders. Our website is www.tmjsleepcenter.com, and we are located on Route 10, which is also Morgantown Road, next to the Penske Building and across the street from Dan's at Green Hills Inn. Thank you.